morning, good afternoon, good evening, wherever you are. My name is James Vititokolom. I'm going to be presenting you on an Astra from the Tottenham National Institute of Medical Arts, John F. Kennedy Medical Center. Thank you. So, John F. Kennedy Medical Center, Liberian, Tottenham National Institute of Medical Arts, TNMA. Media presenter James V.T. Tucker. I'm going to present you an Astra titled Non-Surgical Treatment Outcomes of Manon Omphalocele Admission at the Liberian Japanese French Maternity Hospital Neonatal Intensive Care Unit, John F. Kennedy Medical Center, June 2023, Liberia. These are the authors of this Astra from the Tottenham National Institute of Medical Arts, John F. Kennedy Medical Center, Liberia. Meet the authors: James V.T. Tokolon, Sarah G.B. Colley, Stephen D. Owa, James K. Soso Sr., Rebecca O. Scotland, Hilary Gadamila, Philip Bia Kamon II. Look at the corresponding authors of this article, this Astra. James V.T. Tokolon. Introduction. Omphalocele is a herniated cyst with a congenital mainline abdominal wall defect at the roots of the umbilical cord. Manon Omphalocele is defined as defect size less than 5 cm in diameter in the absence of organs such as liver or spleen in the cyst. Although omphalocele is frequently detected prenatally, but little is known about its prenatal diagnosis, treatment outcome, and follow-up care in Liberia. Objectives of this study: the study aims to ascertain non-surgical treatment outcomes of neonates referred and diagnosed for Manon Omphalocele at the Liberian Japanese French Maternity Hospital, NICU, from birth to 8 weeks old. Methods: is prospective case study with reviews of charts of neonates referred to the Liberian Japanese French Maternity Hospital, NICU, with newly diagnosed Manon Omphalocele in June 2023. The structured interview questionnaires prepared for mothers and the healthcare providers at the NICU for detailed information regarding the histories of the 2 Omphalocele cases identified. The data was collected and analyzed using SPSS version 25. 2 follow-up home visits were done at 4 weeks and 8 weeks to identify treatment outcomes of the defects of the 2 infants. 2 of the 55 neonates admitted during the course of the period had Manon Omphalocele diagnosis. This constitutes 4% of the total admission at the Liberian Japanese French Maternity Hospital. The defect size of the 2 neonates were less than 5 cm in diameter. On admission, the study identified and noted a female neonate with a defect with a body weight of 1.8 kg and a male neonate with a body weight of 2.8 kg. In the first week of life on admission, the female neonate defect size measured 3.5 cm in diameter and the other side measured 20 cm, while the male neonate defect size measured 4 cm in diameter and the other side measured 15 cm. The result continues. The researcher attended 2 home visits during the period. During the first home visit at 4 weeks, a female infant weighed 3.4 kg and had an ulcer size reduced to 2 cm, whereas a male infant weighed 3.9 kg and had an ulcer size reduced to 3 cm. The study measures and noted the two infants' weight of 4 kg and 5 kg at the second home visit at 8 weeks, and there were no ulcers formed. The study did not find any associated congenital abnormalities in the two neonates at birth. Hospital management. The study documented that the minor Omphalocele cases were diagnosed and managed with saline gauze dressing twice daily, application of Savon antiseptics, diazine cream were applied as compared to other studies. After discharge, the wounds were cared for both homes and hospital during the weekly home follow-up visits. Home management. During the two home visits, the following were observed. 1. The use of appropriate personal protective equipment, the use of dressing materials, gloves, hand sanitizers, boiled water, several diazine cream for dressing change, which help to prevent infection and promote healing. Treatment outcomes of minor Omphalocele. See images below of the female neonate. 1-week-old female neonate, defect size measured 3.5 cm in diameter, ulcer size 20 cm. Neonatal period at 4 weeks, follow-up home visit, ulcer size 2 cm. Infancy period at 8 weeks, follow-up home visit, ulcer size will heal. Images, see images below of the male neonate. 1-week-old male neonate, defect size measure 4 cm and the ulcer size 15 cm. Neonatal period at 4 weeks, follow-up home visit, ulcer size 3 cm. Infancy period at 8 weeks, follow-up home visit, ulcer size also healed. That was the progress for this case studies. There were the contributing factors for successful treatment outcomes include health system factors, urban delivery and accessible required health services, maternal factors, educational levels, antenatal care, 4+ visits, good nutritional status, gestation age of pregnancy greater than 37 weeks for the two mothers. Neonatal factors, full-term birth, absence of congenital abnormalities, good attachment and breastfeeding. Gaps observed, we saw few gaps. A lot of psychosocial counseling of mothers by healthcare providers. No treatment guidelines or protocols to manage Omphalocele at the hospitals. No recorded defect size measure found in the treatment charts. Conclusions. The study presents a comprehensive overview of the treatment outcomes and follow-up home visits of neonates diagnosed of minor Omphalocele. The quality health care provided for the minor Omphalocele at both hospital and homes help to improve successful non-surgical treatment outcomes. Mothers' educational levels and willingness enhance rapid treatment outcomes. Urban delivery, availability and accessibility of referral hospital contributed to the improved treatment outcomes. Recommendations: need to develop treatment guidelines and protocols for the management of Omphalocele, including psychosocial counseling for parents of children with congenital defects, recording of defect size in treatment charts. Further clinical research required for this Thank you all. Again, my name is James Fidi Tokolon. I'm the corresponding author of this Astra, and you saw our police who contributed immensely in preparing this Astra. Thank you again. Thank you.